Hello, my name is Bree, and I am going to give a speech about why I think abortion should be legal. Every 7 minutes, a woman dies due to the effects of an illegal, unsafe abortion. As a registered nurse, I have done extensive research on the subject. I bet that everybody in this room's life has been touched by abortion at some point. Whether it be a friend you know, from your own personal experience, or just by watching the news, all of you have been touched in some way by abortion. I present to you that abortion, whether we agree with the premise or not, should remain legal, and women should have access to safe medical care by qualified physicians in the event that they choose to have an abortion. Without legal and safe abortions by qualified medical physicians, the women who desire to have an abortion or to terminate the pregnancy will not have a way to do that, and they're always going to seek alternative ways. This means that they will seek to terminate their pregnancy using illegal methods, which puts them at a grave danger for medical complications and even death, as they won't have access to safe abortions through a licensed medical professional. Abortion is defined by the Merriam-Webster Dictionary as the termination of a pregnancy resulting in the death of a fetus or an embryo. Abortions have been carried out by women since the beginning of time. In the Greco-Roman world, abortion was a common and socially acceptable method of family limitation. While abortion has become significantly less socially acceptable, it is still common practice with women all over the world. Whether we agree on it or not, and whether abortion is an immoral act, making it illegal would simply be too dangerous for us to debate. The fact is, women will always find a way to get an abortion, whether legal or not. Illegal abortions pose an incredible public health risk. Illegal abortions are most often performed by unlicensed people whose only motivation for performing an abortion is to make money. The people who perform these illegal abortions are not regulated in any way and have no reason to be concerned with the health and safety guidelines that they should be. As a result, they provide substandard and unsafe medical care, and put those that are on the receiving end of the abortion at a significant risk for complications such as bleeding, infection, blood clots, stroke, kidney failure, and even death. Furthermore, the incidence of failed abortions resulting in babies being born with significant injuries and deficits increases dramatically in the presence of unregulated, unsafe, and illegal abortions. Let's use the recent case involving Dr. Kermit Gosnell of Pennsylvania, for example. Dr. Gosnell owned and ran an abortion clinic in Pennsylvania. His clinic was one of the few clinics to offer late-term abortions in the state of Pennsylvania. He had owned the clinic for over 40 years. His clinic was operating as an abortion clinic and as a pill mill, prescribing prescription pain medications to anyone for a cost. His only purpose in owning the clinic was greed. He was arrested in 2011 for charges of murder, and his license was revoked due to the extremely unsanitary and unsafe conditions of his clinic. A few charges that he faced were, and a few allegations made by the public, were that his clinic smelled of cat urine, there was feces all over the clinic, there were blood-stained blankets being used for the patients, there were unclean and rusted surgical instruments, fetuses and body parts kept in jars all over the clinic, and many more appalling charges. Dr. Gosnell had no regard for the preservation of human life or any interest in following any safety guidelines. Instead, he only had one purpose, and that was to make money. That's why he opened the pill mill along with the abortion clinic. Outlawing abortions would only promote this type of practice by creating an environment where medical doctors who seek to promote public health and well-being would not be allowed to perform abortions. Abortion used to be illegal in the U.S., but after the Supreme Court heard Roe v. Wade in 1971, they ruled that the state cannot deny a woman right to an abortion. According to Planned Parenthood, in 1965, when abortion was illegal, at least 193 women died from it, and it constituted 17% of all maternal deaths. Today, that number is virtually zero, because of the fact that abortions are legal. Unplanned pregnancy will also contribute to these abortion rates, and it's not going to stop. It's always going to have unplanned pregnancies. According to the Guttmacher Institute for Advancing Sexual and Reproductive Health worldwide, almost half of all the pregnancies in the U.S. are unplanned. Unplanned pregnancy is much more likely to result in an abortion. The rates for unplanned pregnancy has not changed with the legalization of abortion. Abortions are going to happen whether we want them to or not, and whether the general public agrees on the immorality of it. As a society, we can debate on the morality of abortion and whether or not it should be legal until the cows come home. The debate will never end, and people will never likely agree on whether the abortion is right. However, as a civilized and educated nation, we have a duty to provide safe abortions to women who choose to have one. The public health risk is simply too far and too great to outlaw abortions. For some more information on this, you can go to PlannedParenthood.org, which I've used, abortion.procon.org, which I've used, womencenter.com, gutmaker.org, and ourbodiesourselves.org. Thank you.